Welcome to Lilac Dance,
a podcast by two disabled people about creative expression and processing emotions.
My name is Elena.
My name is Heather. Thanks for joining us today. So today we're talking about what my experience was like going to Mayo Clinic for my chronic back pain problems, and also my upcoming surgery that is totally a result of going to Mayo Clinic in September.
Yeah, so tell me, what happened when you went to Mayo Clinic? What was the outcome of that?
Yeah, so when I went, the main way that they were able to diagnose me was that they had me do a CAT scan and an X-ray. And then I went to the doctor's appointment and they have all my history, and they're like, so you've been, having back pain for about 5 years? And I'm like, yes. And they're like, well, we found something on the X-ray. And I'm like, cool.
So what did they find?
Yeah. So they found that I have this syndrome called Bertolotti Syndrome, which basically means that my L5 transverse process vertebrae thing, not a scientist, it's genetically too long. So on my right side. So basically they're like, your pelvis isn't even because you have one bone that's a little bit too long. So they're like, you have all this unevenness, and of course you're gonna have pain. And then they said, because I deal with a high level of pain, I am a candidate for surgery. And they explained what the surgery would be. They would basically stabilize my pelvis with 2 titanium screws, and they would fuse on both sides the sacrum to the ilium, so in both the places of this sacroiliac joints. And the reason that the fusion would help is because it would give stability, but right now, because of the unevenness, there's no stability. So long story short, I want the surgery because I've been going through it for so long. And the surgery is coming up on December 14th, 2023.
Wow, so that's pretty soon.
It is.
So, okay, so you had this pain for a long time and you just found out that it might be, or that it is partly because of genetics, right?
Yeah.
How did it feel to hear that from the doctors?
It was pretty wild. I never thought that my issue was genetic because the onset was an injury. Right. And I talked to them about that, and they were like, well, because you have this thing that's genetic, you had an unstable pelvis, and that's what caused you to be injured.
Yeah.
And they were like, typically with people with Bertolotti syndrome, you see when people get to their 30s and 40s, the chronic pain starts. But for me, the onset was just, I'm a dancer, I danced funny, and then ended up with an injury. And they were like, it just caused the process of the pain to start sooner. So they were like, it's not even necessarily a bad thing that you got injured. Like, it sucks that you got injured. But now we know.
I see.
It's because of genetics.
Okay.
It's not because, oh, I got injured and it never healed. It's like, no.
Right.
But it felt really relieving. It also was frustrating because how come the doctors leading up to my Mayo Clinic visit were unable to diagnose me properly? And it's interesting. I went back to one of my doctors and I told her everything that Mayo found, and she had it in the system because, her doctor's office and Mayo Clinic use the same software. So she was able to look at my x-rays and everything, and all she could do was pull up the CAT scan that I'd had with her earlier this year in March. And she said all the radiologist indicated was mild sacralization. And she's like, a radiologist should be the one to indicate this is Bertolotti.
Right.
So anyway, it got missed. It totally got missed. And she didn't even know what Bertolotti was because apparently it's not very common.
Mm-hmm.
So anyway, she like apologized that it hadn't been found before, but she was also like mostly just mad at the radiologist, which is kind of funny. But anyway, blame sort of all around there, not just on one person.
It sounds like there were a lot of people who could have noticed something if they, but then they didn't. And things sort of became clear when you went to Mayo Clinic, right?
Yeah, and I guess I get it now why Mayo is like, we have to do the x-rays again. Like, we won't accept past scans. And they didn't. Right. Like, when first thing that happened when I arrived at Mayo was like, you're getting an x-ray and you're getting a CAT scan. And like, that just goes to show how like their procedures are set up to really benefit the patients, because if you have a situation like mine, past scans weren't going to cut it because either the scan was done wrong, or I mean, I don't know, but at least the analyzation analysis of the results was totally wrong.
Right.
Yeah.
Wow. So I'm sure you're relieved to have answers. I'm sure it's also frustrating, having gone so long without knowing fully what was going on.
Yeah. No, I'm really relieved. And so yeah, I'd love to share about what this surgery process looks like. So basically, I'm going to Mayo Clinic for the surgery in Rochester, Minnesota. And that's on December 14th. The surgery itself is like maybe 45 minutes or something, relatively short.
Wow, okay.
I'll be under with anesthesia for that, which they expect to go well because I've never had issues with anesthesia when I had my tonsils out when I was young and some other procedures. Then I stay one night in the hospital, which was my choice. They said, oh, you can stay in this care hotel where your dad can help take care of you after surgery. But if you need help, there's only a virtual nurse. And I'm thinking, I need to spend that one night in the hospital just to be safe.
That makes sense.
Especially if, let's say, for some reason I have extreme levels of pain after surgery.
Right.
They can give me IV pain meds if I'm in the hospital. If I'm not in the hospital, they can't do anything.
Right.
So
that's smart.
That's the plan. And then for 2 more nights after, or 3 more nights after surgery, no, I think 2 more nights, I'll be in a hotel with my dad taking care of me. And then on the 17th of December, so 3 days later, I fly back, and then I'll basically be lying down, not moving my pelvis for 4 to 6 weeks.
Wow.
And they said I'll be using a walker. And I'll have a very specific way that I take steps, but they don't want pelvic motion for those 6 weeks.
Wow.
So it's going to be a challenge, but also I've been lying down before because of this injury, which isn't an injury, it's genetic. So I've kind of been there in terms of down and out. I've never had to use a walker though, so that will be a big adjustment.
Yeah. Is there any like physical therapy involved or anything?
So after the 2-month mark, then they'll discuss physical therapy with me.
Oh, okay.
They were like, basically the first 2 months, they say 2 months because they're like, hopefully you'll use a walker for 4 to 6 weeks and then give it a few more weeks. And then once you hit 2 months, then PT, massage, all those things can be considered. They were like, for 2 months, nothing.
Wow.
Just healing.
Okay.
And lying in bed.
Yeah.
But they said after 3 to 4 weeks, I should be able to work from home lying down if I can lie down and use my laptop. So that's good. I'll probably be a little antsy if I didn't have that option.
Right.
So that's really good. Yeah, I'm nervous and excited.
Yeah, no, I can understand that. I mean, it sounds like a major surgery, but if it goes well, it might really help, right? So
exactly. If my pelvis can be stabilized, they said there will at least be a pain reduction.
Yeah.
So that will be huge for me. They can't guarantee no pain because I do have this weird genetic issue. And actually something that people have asked is like, if your bone is too long, why can't they like take a laser and trim the bone? But what I found out is that bones grow back.
Oh, that makes sense.
So anyway, that's why the surgery is like titanium screws and not like, oh, let's trim the bone, make her pelvis equal. Which would be cool, but like it's not.
Right. I guess it's like how like if someone breaks a bone, then like it grows back. Yeah,
right, it's
that's
like the
interesting.
same logic about why they can't do that. But yeah. I think it'll be really interesting to see what my creativity looks like when I'm in bed for those 6 weeks to 2 months.
Yeah, what do you think that'll be like for you?
Well, we haven't had a chance to talk about it on the podcast yet, but much, maybe in the first episode a little bit. But I love to try to learn to make some music using the Syndrome Deluge. And if you want to come visit me, we could do that together.
That'll be perfect. We can do the Deluge for like, what is it, 6 weeks?
Yeah. So, I'll do that. If somebody can help me set up painting, I'd love to. I'm just a little worried about it being messy simply because I can't like stand up and like wash the paintbrushes myself. Like it would require assistance, but it would be nice. I could
hold the canvas for you. Like,
yeah, that'd be cool. We can always like prop something up, but yeah, in terms of like getting it cleaned up, I'm like, I need to have somebody there and like supporting me, or even potentially holding the canvas in a way that I can do it while I lie down. So we will see, but I hope like you can come visit. And
of course, I'll be on winter break.
We could do like music, painting.
Our like Deluge production is gonna go way up.
I hope so. We'll watch a lot of YouTube videos to learn about what you can do on the Deluge. And then hopefully I'll do some work after like those first 3 weeks. That would be really nice. I think that's the gist of everything. Luckily I have my parents who I can stay with, and then I have my partner who I can stay with. So I'll always be able to be with someone, and I have friends for support, and I have grandparents for support. So I think it'll be good.
I'm glad you have a strong support system. I think that's super important for, a major medical procedure like this.
Yeah, I'm super glad.
So is there anything else you want to share with our audience about your either your visit to Mayo Clinic or the upcoming surgery?
I guess the last thing on my mind is that I had to apply to get into Mayo Clinic. And that sucks, because what if there's someone out there who has Bertolotti Syndrome and they don't know, and then they get denied at Mayo Clinic? It's just, I want more doctors to know about Bertolotti, and I want more doctors to look very carefully at x-rays and order x-rays. I think that's the last thing I want to share in regards to the way I feel post Mayo Clinic.
Yeah, I think that's really important. I think that what I've heard from other people who have kind of chronic pain or other chronic conditions is that doctors in school maybe are often taught to recognize the most common things, but not necessarily everything, right? So I really hope that in the future more doctors are informed about that.
Definitely. I hope so. So thank you everyone for listening to this little update pre-surgery. Feel free to send your well wishes in whatever way you would like. You can follow our podcast on Instagram and message us there. It's @Lilac Dance Podcast. Thank you.